Your blood sugar is rising, even when you're careful. And most diabetics don't know why. Morning numbers creeping up. Post-meal spikes higher than expected. And the most frustrating part, you're already trying. Cutting sugar, walking more, drinking the usual remedies. Yet the numbers barely move. In clinical practice, I see this pattern again and again. Patients doing everything right, but their fasting glucose remains stubborn. One patient in his late 50s followed a strict routine. He exercised daily, avoided sweets, even drank traditional remedies every morning like apple cider vinegar. Still, his fasting sugar hovered around 160. Then we made a surprisingly small change. Not a new medication, not a strict diet overhaul, just a tiny seed added at night. Within weeks, his morning readings started falling. The sharp spikes became smoother. Even the tingling in his feet began to ease. He looked at me and asked, "Why didn't anyone tell me about this earlier?" Because most people focus on what to remove from their diet. Very few focus on what slows glucose from entering the bloodstream in the first place. And that is exactly where these tiny seeds change everything. Most people think high blood sugar is only about eating too much sugar. But that's only part of the story. The real problem is how quickly glucose enters your bloodstream. When you eat carbohydrates, your digestive system breaks them down into glucose. That glucose moves from your intestine into your blood. If this happens too fast, your sugar spikes. Insulin tries to bring it down. But repeated spikes make your cells less responsive to insulin. This is called insulin resistance. Once insulin resistance develops, your liver begins releasing glucose overnight, even when you haven't eaten anything. This is why many diabetics wake up with high fasting sugar. It's not what you ate in the morning. It's what happened during the night. Here's the key point most people miss. If you slow down glucose absorption in the gut, you reduce spikes. You lower insulin demand. You improve insulin sensitivity. And over time, fasting sugar begins to improve. This is exactly what certain tiny seeds do. They don't force insulin release. They create a physical barrier in your digestive system. Glucose enters slowly instead of all at once. And that single change can transform how your body handles blood sugar. In today's video, I'm going to reveal not just one, but 3 tiny seeds. And together, they have the potential to bring your morning blood sugar down by almost 50 points. Not overnight miracles, not gimmicks, but simple, natural changes that improve how your body handles glucose while you sleep. Let's start with the first one, the one with the strongest effect on overnight blood sugar. Chia seeds, tiny, almost weightless. But inside your digestive system, they behave very differently. When chia seeds come in contact with water, they absorb liquid and form a thick gel. This gel is made of soluble fiber. And soluble fiber changes how glucose moves through your body. Instead of carbohydrates being absorbed rapidly, the gel slows digestion. Glucose is released gradually. Spikes flatten. Insulin demand drops. But the most interesting effect happens overnight. When taken before bed, soaked chia seeds slow glucose release from the liver. This is the glucose your body produces while you sleep. By reducing this release, chia seeds can help lower fasting blood sugar, the number you see first thing in the morning. Research supports this mechanism. Studies on soluble fiber intake have shown improvements in fasting glucose and modest reductions in 3 months' glucose readings over time. Participants consuming fiber-rich seeds, like chia, experienced smoother glucose curves and reduced insulin resistance markers. Chia seeds also improve satiety. You feel fuller longer. Late-night snacking decreases. This indirectly helps stabilize blood sugar. But how you use chia seeds is critical. Never take them dry. Dry chia seeds expand after absorbing water and may cause digestive discomfort. They must be soaked. The best method is simple. Take 1 tablespoon of chia seeds. Add them to a glass of water. Let them soak for at least 30 minutes. Overnight, soaking works even better. Drink this about 30 to 60 minutes before bedtime. This timing targets overnight glucose production. Start with 1 tablespoon daily. If tolerated well, you may increase to 1.5 tablespoons. Avoid sudden high intake, as excess fiber can cause bloating. Within a few weeks, many people notice smoother fasting readings, less morning spike, more stable numbers throughout the day. And this is just the first seed. The second seed works differently. Instead of mainly slowing glucose absorption, it helps your body respond better to insulin. This second seed is flax seeds. Flax seeds contain lignans and omega-3 fatty acids. Both play a key role in improving insulin sensitivity. When insulin sensitivity improves, glucose moves from your blood into your cells more efficiently. That means less sugar circulating in your bloodstream. Lignans also reduce inflammation. Chronic low-grade inflammation is one of the major drivers of insulin resistance. Reduce inflammation and insulin starts working better. It's that simple. Omega-3 fatty acids in flax seeds also improve blood vessel function. Better circulation means improved glucose delivery to muscles. This helps lower post-meal spikes. Research supports this as well. Clinical studies on flaxseed supplementation have shown modest reductions in fasting glucose and HbA1c levels in people with type 2 diabetes. Some participants also showed improved insulin sensitivity markers after regular use. There's another important benefit. Flax seeds also help with diabetic neuropathy. The omega-3 content supports nerve health and improves microcirculation. This can help reduce tingling, burning, and numbness in the feet and legs. But flax seeds must be used correctly. Whole flax seeds often pass through the digestive system without being fully absorbed. For best results, use ground flax seeds. Freshly ground is ideal, but store-bought ground flax seeds also work. Take 1 tablespoon of ground flax seeds. Mix it in warm water, yogurt, or sprinkle over salad. Evening use works well, especially alongside chia seeds on alternate days. Do not exceed 2 tablespoons per day. Excess intake may cause digestive discomfort. If you're on blood-thinning medication, consult your doctor before using regularly. Flax seeds have mild natural blood-thinning properties. With consistent use, many people notice smoother glucose control, less variability, more stable readings, an improved insulin response. And there's still one more seed. The third seed is one that many people have heard about, but very few use correctly. And its effect on blood sugar is often underestimated. The third seed is black seed, also known as nigella. Unlike chia and flax, black seed doesn't mainly work through fiber. It works through metabolic and anti-inflammatory pathways. The active compound in black seed is thymoquinone. This compound reduces oxidative stress in the body. And oxidative stress plays a major role in worsening insulin resistance. When oxidative stress decreases, cells respond better to insulin. Glucose moves into tissues more efficiently. Blood sugar levels stabilize. Black seed also helps reduce inflammation in pancreatic cells. These are the cells responsible for insulin production. By protecting these cells, black seed may help maintain better insulin function over time. Research supports this effect. Several clinical studies have shown that regular black seed intake can lead to reductions in fasting glucose and HbA1c in people with type 2 diabetes. Some participants also showed improvements in insulin resistance markers. There's another important benefit. Black seed has neuroprotective properties. This makes it particularly useful for diabetics experiencing neuropathy. By improving microcirculation and reducing inflammation, it may help ease burning, tingling, and numbness. But dosing matters. Start with half a teaspoon of black seed powder. Take it with warm water before bedtime. You can also mix it into yogurt. Do not exceed 1 teaspoon daily at the beginning. Black seed is potent, and gradual introduction is better tolerated. Most diabetics also struggle with high blood pressure, and this is where black seed offers an additional advantage. Black seed has been shown to help reduce blood pressure naturally. By improving vascular function and reducing inflammation, it supports healthier circulation. This matters more than many people realize, because high blood sugar and high blood pressure are the 2 biggest drivers of chronic kidney disease in diabetics. When both remain uncontrolled, the tiny filtering units in the kidneys slowly become damaged. But when you improve glucose control and reduce blood pressure, you lower that stress on the kidneys. Over time, this dual benefit may help delay or even reduce the risk of diabetic kidney disease. So black seed isn't just supporting blood sugar. It's also helping protect one of the organs most vulnerable in diabetes, your kidneys. When you look at these three seeds together, something important becomes clear. They don't work in the same way. And that's exactly why they are powerful when used as part of routine. Chia seeds mainly slow glucose absorption. They create that gel-like barrier in the gut. Glucose enters slowly. Spikes flatten. Flax seeds improve insulin sensitivity. Your cells respond better to insulin. Glucose moves into tissues more efficiently. Black seed reduces inflammation and oxidative stress. It protects insulin-producing cells. It also supports blood pressure and kidney health. Three different mechanisms, but all targeting the same problem: unstable blood sugar. This is why relying on just one remedy often gives limited results. Blood sugar regulation is not controlled by a single pathway. It involves digestion, insulin response, inflammation, liver glucose output, and vascular health. These seeds collectively address multiple components: slower absorption, better insulin action, reduced inflammation, improved circulation. That combination leads to more stable readings. Not just temporary drops, but smoother glucose curves throughout the day. And when morning fasting sugar improves, HbA1c often follows, because fasting levels contribute significantly to long-term glucose averages. Now, the next question is, should you take all three together? You can, but a better approach is rotation. This avoids excessive fiber from one source and keeps digestion comfortable. Here's a simple weekly strategy. Day 1 and Day 2, chia seeds. 1 tablespoon soaked in water. Take before bedtime. Day 3 and Day 4, flax seeds. 1 tablespoon of ground flax seeds. Mix with yogurt or warm water in the evening. Day 5 and Day 6, black seed. Half teaspoon with warm water at night. You may increase to 1 teaspoon if tolerated. Day 7, optional rest day, or repeat the seed that worked best for you. This rotation provides different metabolic benefits throughout the week. It also prevents excessive intake of any single component. Another option is combining small amounts. Half tablespoon chia seeds soaked. Half tablespoon ground flax seeds. Taken together in the evening. Then use black seed on alternate days. Whichever method you choose, consistency matters more than perfection. These seeds work gradually, over days and weeks, not hours. Monitor your fasting glucose during this time. You may notice smoother morning readings. Start small. Stay consistent. Watch your morning numbers. And if you found this helpful, share it with someone managing diabetes. Sometimes the smallest seeds create the biggest change.